Well, here in the UK, demand for protective equipment has simply been outstripping supply. But the government says that the NHS supply chain is increasing its capacity. Here's the Senior Cabinet Minister, Michael Gove.
Just yesterday, hundreds of thousands of aprons, eye protectors, respiratory masks, surgical masks and gloves reached the front line. And there is a 24-hour helpline. If any frontline NHS worker is concerned about not having the PPE equipment that they need, they can call in order to make sure that PPE equipment can be delivered.
Well, let's talk to a frontline health worker from Bristol. We're joined by Dr Claudia Paoloni, the president of the Hospital Consultants and Specialists Association, also known as the Doctors' Union. So are you getting the kit that you need?
We're getting repeated messages from our members that it is not coming through in a consistent way. So the answer is it's inconsistent. Yes, we understand that the government's trying very hard, but there clearly are distribution problems, and that's before we've actually increased the need for the supplies. So we are very concerned that the PPE is not getting to where it needs to be quick enough.
So in very straight speaking terms, are your medical teams, are they going in unprotected?
There's a variable amount of PPE. In some cases, we're getting reports of it being rationed because for fear of the need of it at a later stage when more cases have hit the hospitals. But what's also very clear is that everybody should be wearing PPE at all the time. It seems to be a nonsense that whilst we have the whole nation on a lockdown situation, because everyone is deemed to be a COVID potential carrier or a COVID suspect, we're not applying the same rules within the hospitals. And within the hospitals, we don't have social distancing. It's impossible. And if you're treating any patient, you should be protected. You should be wearing protective gear at all times for all interactions with patients. The same rules should be applying within the hospitals as outside the hospitals.
How do your members cope with knowing that then, that potentially they are exposing themselves, increasing their risk even more so?
They're frightened. We've done a survey of our members, a short snapshot survey, and 80% of our respondents were fearful. They don't feel prepared. Don't feel equipped to go forward. But they are NHS workers who will always just carry on and do what is the right thing. But it is not right. It's also very short-sighted. If we don't have the PPE, we won't have a workforce because we've already got a situation of 1 in 4 healthcare workers are off or doctors are off currently, either in self-isolation or because they're ill. So we need to keep them safe. We need to give them the protection to reduce the infection rate for themselves.
In practical terms, explain to us how it works. If a doctor shows symptoms or if any frontline medical worker shows symptoms of coronavirus, how do they get themselves tested?
Well, at the moment, they're not testing. I know the plan is to test, but we are getting repeated messages that they're not getting tested. And what is also concerning, that we are getting messages that there are members of our association that are actually being requested to go back to work if they are self-isolating for reasons of being with a family member who has the illness, and they're actually being requested to go back to work if they don't have symptoms. So the testing needs to be enhanced.
A straight message. Thank you so much, Dr Paoloni. Thank you so much for taking the time to speak to us and explain that. Thank you.
Okay.